Good morning, good afternoon, good evening, wherever you are in the planet. In my previous video, I discussed about legal risk areas. I forgot to mention that there may be exceptions to certain legal risk areas such as assault, battery, and false imprisonment when caring for a client with a mental health disorder experiencing acute distress, who poses a risk to themselves or others. In this situation, the nurse must assess the client to determine loss of control and intervene accordingly. The nurse should use the least restrictive methods initially, but then use interventions such as restraint if the client's behavior indicates the need for this intervention. Today, I'll discuss about clients' rights, or what we call patient's Bill of Rights. This reflects acknowledgement of the client's right to participate in their health care with an emphasis on client autonomy. When clients are hospitalized, these are their rights. They have the right to considerate and respectful care, right to be informed about diagnosis, possible treatments, and likely outcome, and to discuss this information with the healthcare provider. Right to know the names and roles of the persons who are involved in their care. Right to consent or refuse a treatment. Right to have an advance directive. Right to privacy. Right to expect that medical records are confidential. Right to review the medical record and to have information explained. Right to expect that the hospital will provide necessary health services. Right to know if the hospital has relationships with outside parties that may influence treatment or care. Right to consent or refuse to take part in research. Right to be told of realistic care alternatives when hospital care is no longer appropriate. An example of this is when patients choose to be on hospice care. Right to know about hospital rules that affect treatment and about charges and payment methods. Here are the rights for the mentally ill. Right to be treated with dignity and respect. Right to communicate with persons outside the hospital. Right to keep clothing and personal effects with them. Right to religious freedom. Right to be employed. Right to manage property. Right to execute wills. Right to enter into contractual agreements. Right to make purchases. Right to education. Right to habeas corpus or written request for release from the hospital. Right to an independent psychiatric examination. Right to civil service status, including the right to vote. Right to retain licenses, privileges, or permits. Right to sue or be sued. Right to marry or divorce. Right to treatment in the least restrictive setting. Right not to be subject to unnecessary restraints. Right to privacy and confidentiality. Right to informed consent. Right to treatment and to refuse treatment. Right to refuse participation in experimental treatments or research. Laws and standards. American Hospital Association issued Patients' Bill of Rights. American Nurses Association developed the Code of Ethics for Nurses, which defines the nurse's responsibility for upholding clients' rights. Mental Health Systems Act develops rights for mentally ill clients. The Joint Commission developed policy statements on the rights of mentally ill individuals. And Americans with Disabilities Act prohibits discrimination against an individual with disabilities in all areas of public life.